So I was asked to talk about humanitarian missions. Out of the group here, how many people know what humanitarian missions are? What do you think there are?
For a mission, the United States government sends other countries that need aid.
Okay, that's true. It doesn't have to be the United States government. There's other agencies as well. What else? Why do people do humanitarian missions? I'll give you a hint. It's not for the money. Why do you think people go out in the middle of nowhere or maybe to your local community and help out people who number one can't even pay for the care to do? Why would you do that? Anyone? Out of curiosity, how many of you guys here want to be a physician or nurse? I assume most of everyone, or maybe a few. So, Armand, why did you decide that you're interested in medicine?
I think it's a field that you're given a unique privilege to really do some good for others.
Yeah, and that's the thrust of humanitarian missions, is to make an impact. There are those who actually, you guys are very fortunate, you go to a great school, you go to a great community, and there are others out there who do not have the same opportunities you are. I'm going to show you some of those pictures in the meantime.
No, you can just put them in, so you don't even see them.
So I'm going to talk about humanitarian missions, what they're about. Feel free to ask questions at any time, okay? So, as you can tell, I'm a Navy surgeon, and the reason why I'm presenting this is because the Navy actually participates in a whole host of humanitarian missions. We do over 200 worldwide. And what we do is, most of us think about the Navy as going on ships, maybe fighting the war and stuff, but most people don't know that we actually do humanitarian missions. And the reason why we do that is to make an impact. The reason why I stay in the Navy is because I get to do something interesting. Most doctors or nurses you go to your job, you go to your clinic, and you go to the operating room. It's the same thing day in, day out. But they travel different parts of the world to learn a different culture, a different language, and at the same time help people who are less fortunate is meaningful to me. So if you imagine, to give you perspective, let's say that you guys all needed a doctor. If you go to third world countries, in this room, roughly 2 out of this entire group would be able to see a doctor. The rest of you would not be able to see a doctor whatsoever because there's not enough doctors in those countries. They don't have money or they don't have transportation. Here in this country, we actually have pretty good health care. It says about 11% of the world needs surgery because they don't have access to it. And 11% doesn't sound a lot, but if you actually put like in Southeast Asia, it's 48 million people who need surgery who can't get it. I'm part of the United States Navy, and has anyone heard about the USS Mercy? Anyone? Yeah, let's please say fun of you have heard of the USS Mercy. You guys can't be shy. I know that you guys talk a lot before I came in here, so. So the Mercy is this big floating hospital, and I'll talk about it here. And there's one on the West Coast, the USS Mercy, and the Mercy was involved in the tsunami relief back in 2004 and 2005, and then the USS Comfort, which is involved in the Haiti earthquake victims. Its primary mission is, this is basically an oil tanker, and they converted it into a floating hospital. We provide level 1 trauma care, and at the same time we do humanitarian missions. So back in '85, this was actually an oil tanker, and what they did was basically gutted it out, and they actually put a floating hospital in there. And what it actually is able to do is provide care to up to 1,000 patients. It's the largest floating hospital in the world. We have, like I said, 1,000 patients, 80 ICU beds, 400 immediate care beds, and we can, on top of this, we can have 1,100 nurses, doctors, foremen, supporting staff. So this is a ship that can have about 2,100, 2,200 people. It is larger than most hospitals that you see here in San Diego. And we actually have a full capable operating room. We have a CAT scan, physical therapy. We have the full works for it. These are some of the contingent ICU beds, and we even have, just in case there's an infectious disease, we even have an isolation unit, which is very uncommon even in the hospitals here. We can take care of anything, from anything like a routine cut to a socially ill victim. So this is, unfortunately, a gentleman who was in the war who had a gunshot wound to his belly, and was brought to the ship and we took care of him. So do me a favor, if you guys are eating, I'm going to show you some pictures, and you guys are for something, I will stop. So I understand this is not medical school and stuff, but for some of you guys, this might be interesting. I think it medical stuff will be interesting. We have full CAT scan, and like I said, we have full capabilities, including dental and optometry. We do these missions every 2 years. We go to various countries, not only here in Southeast Asia, but we also go to South America. Let's So if you imagine here from 1985 to most recently, we go almost every year on other ships, not just the hospital ship, but we also go on carriers, we go on what we call the gray ball machines. We go through those operations every year. And for us in our Navy, we do 200 missions. So in 2010, I was involved in organizing a mission for Southeast Asia. It's just not the United States. You can see that these are the countries we visited, like Vietnam, Cambodia, Indonesia, Palau, Timor-Leste, Papua New Guinea. Look at the countries here. These are countries all the way from Europe, North America, and Southeast Asia. And then these are all the agencies. So your comment about, is this just the U.S. government? No, there's other people as well who are not in the government who help us out. So if you imagine over there on the screen right is where California is, and the ship is going to go through all these different port stops and make these different areas to do care for all these different countries here. Now, part of my mission in 2012 was this thing called ADVON team, and so it's not just operating and take care of patients, it's organizing it. So imagine when I was in your shoes in high school, I would never thought I would get to do this kind of job, where I get to organize a humanitarian mission that takes care of 120,000 people, operates on over 900 people, and we do that in 3 months. And so this is my team here. This guy here is a preventive medicine guy who deals with infectious disease. This gentleman, Lieutenant Holland, he takes care of logistics, and that is Lieutenant Hall, also my nurse. And we organize the missions, 4 people making a big impact in 4 different countries. It's not about surgery. We also take care of engineering projects. We bring engineers to our ships to build schools and clinics. We do repair their equipment because some of these countries don't have the equipment to repair their own stuff. We even have veterinarians who take care of the animals in different countries and take care of the various cows and bovine and other diseases. We also have community relation projects. So if you guys have been to San Diego Airport, it's awesome, right? It's beautiful. You have a whole bunch of people, you have a whole bunch of airlines and stuff. This is where I landed. This is the airport. That's all you see. And this is the entire airport. And so remember how you go through security? There is no security there. They just dump off your bags and you're supposed to grab it before someone else steals your bag. And this is the one this is the one plane that you get. So for an entire country, this is all they have is for their airport. They don't have much. And this is in the Philippines, by the way. So you have a beautiful school here. These are what the schools typically look like in the Philippines. They don't have much. This is their classroom, this is their recess area, this is their cafeteria. And all they have is a bunch of chairs. So realize these countries are fairly poor. And what our team does is we go to different countries, and we're not trying to force Western medicine on them. We're trying to say, what do you guys need? It's not about America changing their culture. It's about us finding out what they need and what we can provide through being physicians. And we talk to the various elders. We work with the local governments here, and we try to work together because we're trying to build relationships with these countries. The countries are absolutely beautiful. There is hardly any highways, unfortunately, but the place is untouched. But most of the places don't have much as far as any resources. There's no malls. There is no Burger King or McDonald's around the corner. This is what you get. Again, most of the kids don't even go to school. About in some areas, as much as 80% of kids don't go to school. So guess what happens to those kids who don't go to school? It's a dead end. They don't get to go. They don't get to excel. There's no hope for them for college or anything else. And then, of course, sanitation and stuff like this is pretty poor. This is the same place where they clean their clothes, the same place they bathe, the same place they go to the bathroom. It's pretty disgusting. So realize this is where you can make a difference in these people's lives. Most of the houses here in the Philippines are like this in the country. Wonderful air conditioning, no Wi-Fi, nothing like that. So, but again, a different way of looking at things. And for me, you will really appreciate what you have here. When I was in high school, I went to the Philippines for the first time, and it was a culture shock. There was no TV, there was no McDonald's. My sister and brother were always crying because we were always hot and there was mosquitoes. And you realize when you come back here how great we have it. This is the Philippine Army that we worked with, and I'll show you some other pictures here. We travel around the world. Humanitarian missions are cool because it's not just traveling by airplane, but helicopter. Sometimes, if I couldn't find a way, I would get one of these things called a sort of a tricycle, and and literally will bike me to areas so we can spread the word of helping others. How much time do I have? How much?
It's a Wednesday, so 10 minutes.
10 minutes?
Yes.
Okay. So, when we go here, every time that I go and spread the word, this is what happens. Typically, they think that I'm going to do an operation for them, but really I have to screen them. So I'm not just a surgeon. For those who don't know me, I'm a pediatric surgeon and a general surgeon, but I'm not a primary care doctor. But every time I go and stop at a school or a hospital, this is the line of people I meet. And I have to figure out what they have. Like this person has a thing called polydactyl, where they have a double thumb. So you can see that one thumb over here is fused with another thumb. Sometimes they'll have bad burns like this, or sometimes they have like tumors. This is a poor baby that has a tumor on the back of their scalp. Not too gory, is it? No. This is the awesome part. So after we do the planning for the last 5 or 6 weeks, I literally order what kind of stuff I need, what kind of personnel, and the helicopters come in. That's the Japanese military bringing supplies and people. So now we come to the country and we organize the mission. We bring people on the ship to do operations, and we actually take care and do lots of good for these people. And again, you can see the theme I'm talking about, the humanitarian mission. So because we don't have a hospital over there, we do what we can. So we use their gymnasium. And here's the gymnasium here. And you can imagine this is a clinic. So you see, when you guys go to the clinic, these are usually about 10 people. This is a clinic where basically 2,000 people come. And we organize them, and we have to do crowd control. This is over here in the Philippines, this is over here in Cambodia. And we try to organize and figure out which people need help and which people are A-okay, we don't need to help them altogether. But the majority of people we do help. These are my residents. I'm the program director for the General Surgeon Program in the Navy. We're the largest Navy training program for surgeons, and those are some of my residents over there on the upper right. At the same time, I don't work only with residents in the United States, I also work with medical students and other people. Again, we're not only talking about taking care of people, but building relationships with those countries. These are other people on my team here. There's cardiologists, there's an ENT surgeon, there's myself operating with some of the local Cambodian medical students. And I also work with the local surgeons, again, building relationships, making a lasting impact. So this is what we call the patient board. So when you go to a hospital, usually you have this nice digital thing. There's no digital thing here. So we write down on the board of all of our patients. This is one day, and we get to do this for 2 weeks, and you can see all the patients that we deal with. So I'll show you some interesting cases here. So this is unfortunately, and again, if it's too much, please tell me. This is a poor lady who was walking around, and the reason why she came by because she smelled bad, and what happened was she had a breast tumor that had eroded through the skin, as you can see here. Here's this lady here who was walking around, and she was having a hard time sleeping because she had this tumor on her neck, and I'll show you some of the cool images that we do. Imagine, you will never see this in the United States because you have the care here. They don't have the care there, and so you see tumors that are out of control. And then sometimes we have burns. Like most children who get burns, they get care here. But when they have burns in other countries, they don't get to see a doctor. And what happens is that burn scars in the hand, and slowly over time it becomes stiff, and then you can't use your hand. And so we do operations to help them so they can use their hand again. And then these are hernias and other masses that you can see. These are fairly large. Usually, I don't even see these here in the United States. I always see these when I go across countries. This was a adolescent who had this bump on the shoulder, and he thought he just bumped it on the door. But what it was a tumor that had been growing for 5 years. And what we did is we took off that tumor off the shoulder. There's the tumor, and then we put a skin graft, all brand new, and we healed it of this cancer. Questions on that so far? Other ones is that in those countries, you know, you have those labels on like bad materials like acids and bases and stuff that you learn in chemistry. Well, they don't have labels there. And sometimes they think that they're washing their stuff with soap and it ends up being acid there. So what these people get is these little contractures, and now all of a sudden their foot can't move altogether, they can't walk. And so we do operations to release that so they can walk again. Here's our team over here, and this is Shen Jensen, one of my residents. And there's this gentleman that we took off that little scar tissue from the burn, and now the person can move their ankle for the first time in many years. And those are more pictures of the same. Sort of the foot here, so we took out that scar tissue there, and then we closed it, and it looks brand new. Remember that lady with that big neck mass? So that ended up being a tumor, and what we did is we did a 3D CAT scan. So here's a CAT scan. Does everyone know what a CAT scan is? So a CAT scan is like a full X-ray that you can see the inside. So you can see the skull here, you can see the eyes, and there's the jaw, and there's this tumor that's actually involving to the jaw there. And what we did is, I know it's might be too bored for you guys. So we took this tumor here, and now it's completely gone from her. So now for the first time she can breathe normally and eat normally. Okay. And that's how she looks now. So again, an awesome thing, you know. You go home, you go to sleep, and while here's this lady who's been begging for help. And these people don't come like 3 miles. Some people actually go over canoes and walk hundreds of miles to come to us. That's how bad they want the care. And for this lady, I don't care if I don't get paid. It's just the fact that I make a difference in this person's life. And that's why we do it. So these are other deformities. Sometimes they'll have this thing looks like it's a mass in the nose, but this is actually a tumor from the brain rolling to the nose. And then there's other thyroid tumors, thyroids that land in the neck that sometimes grows a lot. This happens a lot in third world countries. And again, here's another thyroid mass you can see here. And we take care of these fairly expeditiously, and once we take it out, they actually live normal lives. I'm a pediatric surgeon, so I take care of little babies and infants, and this was an interesting story. This was a child that was about 18 months old, and the doctor said that they felt a hard softball-sized mass, and they couldn't do anything for the child because they assumed it was cancer. This mom wouldn't take no for an answer, so she literally took a canoe, and when I say canoe, it's not the one that you buy over at Walmart. She chiseled it out of a tree, went across the ocean to the next island, which we were at, went about 80 miles and walked that way to bring her child to us. And what I felt was this big mass here. You can see this is the kid's belly, this is the kid's chest, and you can see this big mass here. Can you see that, guys? So we did a CAT scan, and what we noticed is that there was something unusual. So this is the chest, this is the X-ray, this is the belly here, and we noticed that there was some, see that white spots there? It looks like there was some extra bone in there. And we looked inside that mass, and we could even see a spine inside that mass. And then we did X-ray, and this is a CAT scan. And what the CAT scan is you take a loaf of bread and you put it on its side, you take slices, right? And what you do is you're looking on the inside. So we're looking at a slice of the inside, and we found that there was a spine inside this mass. And more interesting is that you can see that there is a spine, bones of the leg, and what happened was this kid has a very rare 1 in a million diagnosis called fetus in situ. And what this is basically, you know what twins are? This child didn't have a cancer, which is good, but basically absorbed his twin inside his belly. So this was a baby who had a baby. Very odd, very rare. So you can see there's the baby's spine and legs on the CAT scan, and you can see the spine of it. So he absorbed his twin. So I tried to call across to Southeast Asia anyone else who could take care of this, and no one was. And so I asked the U.S. Navy if I could do this operation, although rare, and we did. We actually did the operation there. You can see this is the extra. It doesn't look like the same, but this is basically what it looks like from the inside the belly, and that's what it looks like here. This big gel here, and what we did is we took it out. I'm going to look at this real quick. This is for my residents to place them on anatomy. Are you guys okay? I went too fast. Way too fast. So, my time up?
Yeah.
So basically, what we do for humanitarian mission. If you guys have any questions on why we do it, I'll stand up here and you guys can pass it back. Alright?
Thank you.
Big round of applause for Dr. You guys make sure that your area is clean. We don't want to